And welcome to the first Carolina chapter of the Arthritis Foundation's Coffee Chat. I am Mary Proskus. I have been living with rheumatoid arthritis for over 14 years, and I've been working with the foundation for the last 7 years. And I currently serve as a board member for the Carolina chapter. We want to thank Ortho Carolina for being our presenting sponsor for 2021 and their doctors to meet with us. And through all of this, we'll be making a positive impact on the arthritis community so we can all continue to learn and live yes. So we've got a great guest today. We have Dr. Michael Bates. So, hi, Dr. Bates, and welcome.
Hello, thank you.
Go ahead and share a little bit about yourself and then why you got into orthopedic surgery and why you became an orthopedic surgeon.
Yeah, for sure. So again, Michael Bates. I am an orthopedic surgeon specializing in hip and knee arthritis. I practice at Ortho Carolina at the University City location. My route to medicine and orthopedics was a little bit circuitous, to put it lightly. I actually started off doing nursing. My older sister was a nurse. So I worked as an ICU nurse for about 5 years, and along the way decided that I would go back and go to medical school. I went to medical school with my ICU background, initially thinking I was going to be a cardiologist. And once I was in medical school, I quickly realized that I really liked surgery and the ability to see people improve and help people by manipulating anatomy. And that just really appealed to me. At that point, it was picking a surgical specialty. Orthopedics just made sense to me. I enjoyed it. It didn't feel like work. So I decided to go in orthopedics, finished residency, and then later went on to subspecialize in hip and knee replacement surgery. So that is not how I drew it up many years ago, but this is where I ended up.
Yeah.
Yeah, that's my a little bit of a different story.
Yeah, I think growing up I wanted to be 17 different things. So, you get
Right.
there when you get there. I also
Exactly.
like to pretend that I am my own doctor because I love medicine. I think it's so fascinating, but I am not OChem was, some of the
Yeah, that's a
requirements
tough
and
one.
so to get me to, buckle down and focus and study was kind of out of the question. So
Yeah.
it's actually a cool path though, to go. You've seen kind of all the different areas and probably seen a lot of cool stuff. So at
I
least
tell you
you
what, if
picked.
if I could do it again, I would probably do it the same way. I think working at the bedside as a nurse,
Mhm.
taking care of patients, gives you a completely different perspective. You have
Yep.
a lot more insight in what it
Mhm.
means to take care of people. So I didn't draw it up that way, but I'm really glad I did it that way.
Yeah, yeah, no, that's great. And I think patients like to be heard. So, you listen. Not everyone likes to listen.
You got
Um,
it.
but okay, so given that you specialize with hip and knees and especially with arthritis, what are some top three tips that you have for people to help preserve their joints? Or, and if someone who's living with, already has extensive joint damage, do you have any other tips and tricks for them to preserve what is left or to help ease pain from all that?
Yeah. The first thing I'll say is this: it's way easier to preserve what you have left than
Mhm.
it is to try to live with it once you already have extensive damage. And, if I'm being completely honest, some of that is determined by your genetics. So you're not going to have a lot of control over that.
Mhm.
We know that there's a genetic component to the development of certain types of arthritis. However, you absolutely do have some control over it. By far, the most profound thing people can do is maintain a healthy weight. And sometimes that sounds like typical doctor preaching is healthy weight, eat a good diet. But in this regard, having significant extra weight means that extra weight is transferred to your joints. And when you think about the fact that you are taking 5,000, 10,000 steps a day, every step with that extra weight is going to wear away cartilage. Now, it's important to think about that because the cartilage we get is the only cartilage we ever get. When it goes away, it doesn't come back. It's just like our adult teeth. If something happens to one, you don't get a replacement one.
Yep.
So it's really, really important to protect what you have. One analogy I give people is just like a car tire. When the rubber wears off the tire, there's no quick way to fix that. You got to put a new tire on there. In the case of the human body, that's a big surgery, however. So I think it's healthy weight. I do recommend people stay as active as they can. Some folks always say, well, should I just kind of be sedentary so I don't wear my joints out? And no, I don't think that's the way you should do it. I think you should be as active as your knees or your hips will allow. That helps you maintain a healthy weight, which we know is critical for it, not to mention all the other benefits of just being healthy.
Yeah, I was going to say, through my journey, for the first year or two, I think the pain was just so excruciating. I was like, I don't know what to do with these flares. I don't know how to manage. So I thought not moving at all was the best course of action. And then slowly but surely, I was like, nope, I would just hop on an elliptical. I've been low impact for a long time, but I think, now I can be like, oh, this is where my fake medical wannabe, background comes in.
Yeah, absolutely. If you can stay active, find an activity that you can tolerate and try to do it. Some of the treatments that we do, when you think about it, we're trying to control the symptoms to allow people to do the activities they need to be able to do and want to be able to do. It's not always trying to cure or get rid of arthritis, but to manage it so that you can stay active.
Yep. Yeah, I think, and that's kind of leads into this next question and continues this conversation of, is there more to maintaining mobility, other than just staying active? Like, are there certain stretches, or is it really just kind of getting up and walking and doing what your body can tolerate and what it could handle?
It's a lot of the latter. And, we talk about formalized physical therapy, and a lot of times I tell my patients I want you to do functional physical therapy or real life physical therapy, which means be active in your real day-to-day life, right? That means exercising in your neighborhood, going for walks and that kind of thing. But specifically, when you're talking about an inflammatory arthritis like RA or some of the other ones, psoriatic arthritis, the group of medications called the DMARDs, the disease modifying anti-rheumatic drugs, they've really been revolutionary. They have taken a condition like rheumatoid arthritis or juvenile rheumatoid arthritis and drastically changed the course of that condition. So they are probably the hallmark of the treatment for inflammatory arthritis specifically, not osteoarthritis.
Yep.
And those medications are incredibly effective and go a long way into preserving the function of the joints. But I think the individual still has a responsibility to maintain a good level of activity as well.
Yeah. Yeah, I think that treatment has completely changed my, I went from 0 to 1,000 with my inflammatory and like my inflammation, and I've noticed quality of life. So it's encouraging for all those arthritis warriors listening. It's very encouraging that advancements are being made to help, but we also have to, advance ourselves and make sure that we're staying mobile and active. And you had mentioned living like a healthy lifestyle. And we all know that people's diagnoses are different. But that goes along with exercise. When you look at diet, do you think that one diet is best? Like, there's keto, there's paleo, there's Mediterranean, then there's people who just find a good balance. Do you think what's your opinion?
I talk to a lot of folks, and especially a lot of folks who are trying to lose weight. And you named a few of the different diets out there, and those are fine, especially Mediterranean diet is one of the ones that is most highly recommended. That being said, for the specific purpose of arthritis, do I think that one is more important? Not particularly. I think it's more overarching goals, right? If you can find a diet that allows you to stay healthy, keep the calories down, maintain a healthy weight, I think that is by far more important than which diet you select. So I've seen people be pretty successful in this regard, doing a multitude of different diets. It's always better to do one that's sustainable, not the most recent fad crash diet, starve yourself or drink this magic solution,
Yeah.
right? That's not sustainable. That just means your weight comes down and then it goes right back up and you're more frustrated than when you started.
Yeah.
But I think, the decision on which diet makes sense may be maybe even more relevant for some other conditions, cardiovascular wise and that kind of thing. But I think as long as you can find one that works for you, you can meet your health goals, you can pick between multiple.
Right. Yep. I will say I tried a bunch of different things, but sometimes I just like a certain thing and I'm not willing to not willing to sacrifice. But you do want
Exactly.
the
You just
long-term longevity.
you got to be
So,
realistic about these
yes,
diets.
exactly.
You got to treat yourself sometimes.
Yes. So speaking of treatment,
Yep.
this is a double-sided question or double-ended question, whichever way.
Mhm.
So, are there additional treatment options that kind of coincide with the prescribed treatment? Like going in and getting like certain massages, or saunas, or the cryotherapy, the super cold
Yeah.
tubs. Are there benefits to that, in terms of, helping either with your joint damage or with, your inflammation? And then the other side of this question is, are there options for treatment that you recommend before determining that surgery is the best course for a patient?
Yeah, sure. Well, to answer that first question, are there other treatments that go along with the more traditional treatments like medicine? And the answer is absolutely. So, the caveat is we tend to be very evidence-based in orthopedic surgery, and we try to recommend things where we have good science and data and studies to help us make that recommendation. We have really great evidence that physical therapy can help manage the symptoms of arthritis quite significantly. However, there are many things that we talk about when obviously we see many people that have these conditions. And anecdotally, you certainly start to get recurring themes of other treatments which people find very helpful. Um, we get a lot of feedback on things like dry needling, um,
Mhm.
massage therapy. Those things I think have a real potential benefit for folks, especially considering there's a very minimal downside risk.
Mhm.
So anytime we have potential treatments that they may not be the most mainstream or be in the chapter for how do you treat rheumatoid arthritis or osteoarthritis, we certainly I think have an idea that some people really can benefit from them.
Mhm.
From my standpoint, if we can help you improve without having to use one more medication, that's going to always be a better situation. Not only because most people don't like taking a bunch of medicine, but
Mhm.
because you learn things and techniques that you can use on your own for a lifetime.
Yep.
And you don't always have to call your doctor and get another prescription and that kind of thing. So I think overall, the answer is yes. And we just have to be open minded. Sometimes I think we can be a little narrow minded as surgeons because we learn a certain way. But I think as you talk to more and more people, you really learn that there's some other things that truly do help people.
Mm.
To answer the second question, are there things that we try before surgery? Absolutely. This surprises a lot of people, but at least in my practice, 90% of the treatment I recommend for my patients is non surgical. So
Mhm.
it is usually the exception that a person is at the point they need to have knee replacement or hip replacement. At the very least, we will attempt to try more conservative measures first. So we use all different types of things. Like I said, it can be physical therapy, it can be water aerobics. That's a fan favorite, right? You can get a good workout in without your knees or hips killing you that night. So that's a really good one. We use anti-inflammatory medications, we use injections, we use ice or heat, all those things we try to incorporate. Now, Obviously, if a person is able to, walk 5 miles a day and do those kind of things, we're going to stick to more conservative treatments. And
Mhm.
you may have some folks who are really struggling and the pain becomes severe. In that situation, yeah, we're going to be more likely to talk about surgery, but we always try to match the severity of the arthritis with the treatment.
Mhm. Which, as an arthritis patient, I appreciate, the more holistic approach because
Absolutely.
I believe in medicine. I believe in like it's fantastic. And again, my treatment plan is just phenomenal. I live a great life despite some of my challenges. But to not be so narrow-minded, to have doctors who are opening up their opinions and being like, okay, we know you that this medication works, but let's try this to help, that goes with it. So, um, I think that is great. So if a patient comes into Ortho Carolina and they do end up needing a knee or hip replacement, what can a patient expect after that replacement? And what's the typical recovery time? And then how long do the benefits of this replacement last?
Yeah, so that's a good question. The first thing I try to explain to people is these are significant surgeries. And I like to just be very straightforward with people, and they're very doable and they help thousands of people per year, but they're significant surgeries. What do you expect afterwards? Well, many of the surgeries, at least now in my practice, are done as an outpatient, which is, I think, pretty cool because you get to recover at home for the most part.
Yeah.
Some of the things that have changed over the past 10, 15 years or so is we tend to be much more aggressive on early mobilization, which means there's no longer you have a replacement and then you lay in bed for 2 or 3 days and that kind of thing.
Hmm.
Now it's more so you have your surgery and 2 or 3 hours after your surgery, we expect you to be up, walking around, practicing, going up and down stairs with a physical therapist. That's been a really big difference, and I think has been for the better, of course.
Hmm.
The recovery afterwards, once you're at home, those first several weeks are where we're going to, probably the first couple of weeks is where we're going to focus the most on controlling pain, making sure that you're progressing with physical therapy. We do that with pain medications and other modalities as well. How long does it take to recover is a common question, and it really depends on how do you define recovery when you think about it. If you have a hip replacement, for say, uh, folks may say, well, when can I go back to work or that kind of thing? Well, during coronavirus, a lot of people are working from home. So people are going back to work in 2 weeks or 3 weeks because they're on their sofa on their computer. Before that, I would tell people 6 weeks after hip replacement, you can
Hmm.
go back to work, but things have changed quite a bit. And usually for knee replacement, I say it's 2 to 3 weeks longer. Almost any person that you speak to that has had both hip replacement surgery and knee replacement will almost invariably say that the hip replacement surgery is, I hate to use this word, but easier to recover from than knee replacement. And that's what I've seen in my observations as well. And the other thing that I try to reinforce is you may feel like $1 million 3 weeks after your hip replacement, and you're saying, well, I don't know why I can't go play golf or go for a run. And we know people do those things. But one of the things we always try to focus on is even if you feel really well 3 or 4 weeks later, the improvement after these surgeries will continue happening for many months.
Hmm.
After knee replacement, it's not uncommon for people, even 8 months later, 10 months later, to say that month by month they still feel better, their knee feels stronger, and so forth.
Hmm.
So I think the first few weeks is where we focus the most on the pain control and getting you very active working with physical therapy. The improvement in pain can be very rapid, and sometimes it surprises people how quickly they start to do better. But the overall recovery, before you get to the point where you forget that you even had a replacement surgery, typically we're looking in the order of months.
Okay. I find it very interesting, and I'm like literally trying to like think things through my head that a hip replacement would be a quicker recovery than a knee replacement. I'm just trying to think of the basic anatomy of walking. And I guess maybe your knee bears more weight, so maybe that's why. But I think I would have flipped it.
I'll be honest, as a surgeon who does both, I am still somewhat perplexed by this. So it's not just you, it's even a surgeon who does both surgeries. There is nothing about a hip replacement which is smaller than a knee replacement.
Mhm.
Now, the joints are very, very different. If you think about your hip joint, you have a really big ball which sits inside of a really big socket,
Right.
and it's intrinsically very stable, and the force is spread out over a big area. If you think about your knee, it's kind of different than that. It's almost like you have a flat surface, kind of like this, and then you have a round ball that sits on top of it. And
Mm.
it's able to slide around if it were not for all the specialized ligaments you have in your knee. So I do think the knee joint has some additional complexity to it that takes a little bit more doing when we're doing the surgery sometimes, as well as with the recovery process. But it is somewhat jarring sometimes when you see a person that you just did a hip replacement on, you know how much surgery we just performed, and
Right.
the person is walking down the hallway, it's better than when they came in for their surgery. It's really it's an awesome thing to see.
So, and now that you mentioned that you can do this kind of as an outpatient surgery, how has technology advanced? Or, like, what kind of technologies are you guys using that you can do a joint replacement and you can send that patient home that day?
Yeah, it's really multifaceted. There's probably not one specific technological leap that allows us to do this. It's multifactorial, right? We have our anesthesia colleagues who have a great deal to do with how well we can mobilize patients. We try to use anesthetics that minimize the risk of postoperative complications, number one, because if you're nauseated, you are not going to feel like getting up and walking after surgery and being able to go home. So little things like that are actually a really big deal. Pain control, we use a lot of local anesthetics that we inject in the area of the surgery, which have a minimal impact on you systemically so you don't feel groggy and that kind of thing. Our anesthesiologists will do other types of regional blocks where we can control pain locally, and some of those blocks will last 24 hours or so. One of the things that I personally do is we implant a little tiny catheter that goes inside the joint, and it actually drips a numbing medicine in there around the clock
Mhm.
for about 3 days after the surgery. And that's a really good way to control pain and minimize how much hydrocodone a person has to take.
Right.
And then you can talk about different surgical approaches. There's multiple ways to do these surgeries. Unfortunately, all of them work very well. I personally do anterior approach to the hip, and in my hands, I have found that my patients are able to get up and move very, very quickly. And I think that's another piece of the puzzle. But
Mhm.
ultimately, I don't think there's one magic solution. There's no panacea. A lot of small things have to come together to be able to see folks have large surgeries, but they don't realize they just had a large surgery. I mean, that's
Mhm.
kind of a success story when the person doesn't realize how big of a surgery they just had.
Right. No, that's cool. I mean, I think that's really cool that you're like, I was just sitting here like working on your hip and like your
It's
joint was just so bad. And it's like, here you are, just like quality of life,
it's
180.
it really is amazing. And after doing this for several years, I still sometimes see my patient and I'm like, this is just amazing to me,
Yeah.
But it's one of the cooler parts of my job by far, right?
Yeah. No,
Yeah.
I love it. So, can you talk about Ortho Carolina's partnership with Experience Anatomy?
Yeah, it's actually pretty cool. If you haven't heard, Experience Anatomy is um, one of our partners in education, and what they do is specialize in training and education with real preserved human specimens. So a big part of what we do is education and continually learning, trying to refine our surgical techniques, and this allows us to do it with up close experiences, which are really realistic. So we can refine our techniques, our knowledge in a laboratory setting with the expertise and help of Experience Anatomy. And those things hopefully will lead to either educating others where we can show people this is what it looks like inside of the knee joint. These are the ligaments that we have to be concerned about. and for us, helps us refine our skills as well. So it's been a really good partnership, and we've done some educational programs so far that have been very well received, and we continue to work with them pretty extensively.
Cool. That sounds cool. Yeah. I'm a wannabe doctor. I think medicine is just so fascinating. Like I would be like, oh, what are you doing? I just want to go shadow doctors and like shadow surgeons and be like, what are you
Yeah,
doing? Oh, what you doing in there? Why are you doing that?
I
So,
mean, this is really cool stuff. I mean, if you can't get excited about the things that we're doing, well, I hope you wouldn't be a surgeon. But I mean,
right.
this is really cool, amazing stuff to see. It's
Yeah.
when you take a step back and just think about, you go to work, you perform surgery where you're actually manipulating human tissue,
Hmm.
a person's body, and
Yeah.
you can make them better. It's just, I mean, it really is amazing. It's super interesting, and I don't mean the Grey's Anatomy type stuff. Just the science itself is pretty cool, right?
Yeah. Oh, yeah. You change
Yeah.
lives and it's just fantastic.
Yeah,
It's
it
awesome.
really is. It's in many ways it's very humbling, but
Mhm.
it's just awesome to see people better,
Yeah.
after that intervention. It's really humbling.
Yeah. And I know as someone who knows joint pain and knows inflammation and being swollen and just all that fun stuff. Just, when you go flare free and then you wake up and you have a flare, just like you forget how miserable it is. So, for someone who experiences such great pain, then to have something that just helps them in like their quality of life, it just completely changes. And it's all at,
Literally, it
um,
may not save a life, but I will tell you, it really changes life. And
yeah,
sometimes we say it gives people their life back. I mean,
yep,
it's really profound to see how some people's lives are impacted by this. And I know you're, certainly shared your story with rheumatoid arthritis. My mother has had rheumatoid arthritis for years, so I've kind of seen her, her journey through it and trying to find the correct cocktail of medications. And, for her, kind of like what we talked about earlier, even though she does take the DMARDs or those disease modifying antiemetic drugs, by far her biggest treatment is exercise. And even though
yep.
my mother is, let's see, well, I'm not going to say her age, I might get in trouble, but I will tell you,
Appreciate that.
yeah, I will tell you that she power walks 5 days a week, 5 miles per day. And that is summertime, cold weather, wintertime. If
Yeah.
she doesn't do that, she notices that her joints become more stiff and painful. So for her, that may as well be written on a prescription because that
Yep.
is part of her therapy. So that's why I say the medicines are great, but a lot of the things are things that the individual can do to help themselves.
Yep. Yeah. I mean, going on maybe 5 years, I got tired of the elliptical. I became like a spin fanatic and I was
Yeah,
spinning 4 to 6 days a week. It just kind of depended on the schedule. And I mean, again, I could be having a flare, but it's let me hop on the bike and just pedal it out because you do notice on days when you don't use your joints, it's kind of, they get more stiff and you're like, okay, well, joints, I'm going to preserve you. I'm going to show you that I love you. So let me move you. And, no,
absolutely.
that's, that's fantastic.
Yeah,
So,
absolutely.
kind of going back to, seeing patients that you see, what are some signs and symptoms that patients should look for or watch for to show that they might need a further evaluation by you and your team?
Yeah. Well, I think most people are going to be experiencing pain. So that part is obvious. That
Hmm.
doesn't mean every time you feel pain, you have to feel the need to go see your doctor. However, there are some signs and symptoms that deserve a little bit more attention. One of which, if you feel as though you don't trust your joint anymore, you feel like your knee's giving out or your hip's going to give out, and that actually happens and people can fall, we get a little bit more concerned then because it'll lead to other injuries like fractures, and also we don't want that.
Right.
If the pain increases to the point where you have trouble going to sleep at night, that's a big deal because when you can't sleep, most people are not easiest people to be around the next day when you haven't slept, right? So yeah, that kind of affects the whole family. Sometimes it's the person's spouse or family who demands they go in and get evaluated for that reason. And when it starts to function affect your ability to function, if you're missing time from work because your joints are hurting you so bad, you're getting in trouble at your job. That's a big one. If you're getting to the point you have to consider taking strong pain medication like opiates, we're really getting pretty far into treatments that we have to be careful with. And that's when I think you really do need to talk to your doctor about other potential avenues. Those are probably four of the bigger ones: lack of sleep, trouble with your job, having to require opiate prescriptions, and so forth.
So what does a first-time consultation look like when you go to your office?
Yeah, a first-time consultation, it probably takes about 30 minutes. There's probably three big things we're going to do. Probably the most important of which is going to be me trying to listen and understand exactly what about the symptoms are bothering you, how it's impacting you. Some folks, it may be the pain itself. Some folks, it's they can't exercise or do the activity they like. And some folks, it's, I'm getting in trouble in my job. So getting that information kind of helps us figure out which direction to go. The second part is to get x-rays usually so we can evaluate the integrity of the joint, make an assessment of the condition of the cartilage in the joint, and that gives us obviously some objective information to go along with what the individual is concerned about. And then we put those two things together. And then the third part is trying to make recommendations. And that's important because the recommendations have to be tailored based on both of the first two things. You can have a really impressive x-ray where a person has severe joint space changes due to their arthritis, but they could have really good clinical function. They could be very active. And if that's the case, well, you have to make probably a more conservative recommendation. How can I help this person stay active as long as possible and avoid the need for surgery? If you have a person who has more moderate x-ray findings, but yet their clinical function is horrible, they can't sleep, they're taking high dose pain medication, and they're getting in trouble at work, that's a person you have to address with a little bit more urgency. So to recap, it's about a 30-minute evaluation, and we try to put those first two things together: how you are feeling and how significant is the condition based on things like x-rays, to help us figure out that third part: what is the best treatment?
Gotcha. All right. And then lastly, the big plug. So how do patients get in contact with your office?
Oh, yeah. So we try to be in the 21st century here. So we can do it online. So you can go to orthocarolina.com/Bates, just my last name. And then you'll see a picture of me and the folks who I work with. And there's a little button up there you can click on to schedule an appointment, or you can just call us. We still do it the old fashioned way at 704-323-2100. And but we try to make it as easy as possible for people to make appointments and make sure we have availability and that type of thing. So.
Awesome. Well, I think we've covered all of our questions for today. Do you have any key things that you want to share that we haven't already talked about, or you want to reinforce?
Yeah, I do. I will say I just finished up in my office today, so I've talked to a bunch of people today, and we get some recurring questions. And one of the things I always try to really instill in patients, because one of the most common questions people are concerned about is, am I damaging my knees by doing X, Y, or Z? After we do a treatment, whether it's a medication or an injection, they're always concerned about pushing it too hard. And I always tell people, if you have arthritis in your joint, whether it's rheumatoid, whether it's osteoarthritis, within reason, the arthritis will be there, whether you're a couch potato or whether you're trying to climb Mount Everest. So I always want to encourage people to try to stay as active as you can, whatever your symptoms will allow you to do, and then let us try to find ways to help you manage those symptoms. But don't let the arthritis slow you down to the point you become sedentary, start backing off the things you do for enjoyment or you do for your health. So you have to fight back against the arthritis a little bit. We will try to help you do that. That may be something really easy like a physical therapy or a medication. It could involve surgery, but we'll try to tailor that to the individual situation.
Yep. Every warrior needs to climb their own Everest.
Yes, absolutely.
So, I like that. All right. Well, thank you so much for your time today. And again, if you want to schedule an appointment with Dr. Bates, you can go to orthocarolina.com and / or /.
I think it's / Bates, but if it's not / then it's the other one.
Well, we get to the main page. So, all right, Dr. Bates, thank you very much for your time today. It was nice to chat with you.
Likewise, I enjoyed it. Thank you.
Thank you. Have a great one.
You as well.